Hello everyone, this is EMS Platypus and I'm going to talk about the cardiovascular system for EMTs. Cardiac anatomy can be a little confusing when you first start looking at it. I do want you to remember some key elements, some terminology, and that will help you. Now when you're looking at the heart, you're looking at it from the patient's own perspective. So the patient's left is the left side of the heart. Now the heart is a two-pump organ. The right side pushes blood to the lungs. The left side pushes blood throughout the entire body. You can further divide the heart into upper or lower portions. The superior or upper part are called the atrium, and I think of it as the attic of the heart. The lower portion, inferior portion, are called the ventricles. Within the heart, you have 4 valves, and these valves stop the blood from going in the wrong direction. Now you have 2 valves between each of the left and right atrium and ventricles, and then you also have 2 semilunar valves that separate the ventricle and the artery. Now remember, arteries always lead blood away from the heart. Now, in your textbook, you'll see versions of the heart like this. And remember, the heart is a simple pump, and it is pushing blood throughout the entire body. Now, the blood should be contained within a vascular system, which is the tubing or container that holds the blood as it's pushed throughout the body. But when we're looking at this and trying to study it, it can be a little confusing. So, I want you to think about it in a simple version. Now, it doesn't matter whether we're talking about the left or right side of the heart. Blood will enter the heart through veins. Now remember, the vena cava is the largest vein in the body. The veins will pool the blood in the atrium, and then it will go through the AV valve, the cuspid valve, and go into the ventricle. Between the ventricles and the arteries, we have the semilunar valve, and then we have the artery, and the arteries always lead blood away from the heart. Now, the aorta is the largest artery in the body. Following that context, it doesn't matter whether we're on the right or left side of the heart. We will have vein, atrium, a valve, a cuspid valve, ventricles, a valve, and then an artery again. So I remember VA valve, V valve A. And by following that pathway, I can identify where I am within the heart. Now, the vasculature is the container or the tubing that the blood is pushed through. Arteries will lead away from the heart and branch into smaller arteries called arterioles. Eventually they'll get to capillaries, and that is where gas exchange will take place. Then it will lead to venules, then veins, and then into the vena cava, all veins will eventually lead back to the atrium of the heart. Now that we've talked about the anatomy, let's talk about cardiac physiology. The heart has its own heartbeat through automaticity. It's able to generate its own pattern or heartbeat. Now, the pacemaker of the heart is called the SA node. SA stands for the sinoatrial node, and that's why when people have a normal heart rhythm on an EKG, we will call it a sinus rhythm. We do have a backup system called the AV node, or atrial ventricular junction. And if the backup system is working and the primary pacemaker is not, then we will call it a junctional rhythm. The heart has a last-ditch effort that it will also try to employ if the primary and secondary pacemaker is not working, and those are called Purkinje fibers, which are located throughout the ventricles. And when these are firing, this is when we will see VFib or VTAC. And when we see these rhythms, we automatically need to shock that rhythm. Now, we're not going to get into a lot of EKGs, but you do need to understand what VFib, VTAC, asystole, and a normal sinus rhythm look like. So we will be talking about that in class. The last thing I want to leave you with is the perfusion of the cardiac muscle. In order for the pump to work, the muscle needs oxygen and glucose. Now, the heart is greedy. It's going to feed itself, and it takes blood directly from the aorta to feed the coronary arteries. Now, the coronary arteries supply blood to the heart muscle, and this is where you will have this is where heart attacks happen. The heart attacks happen in the coronary arteries that feed the heart muscle. That is why a heart attack is called a myo, which means muscle, cardio, which means heart, infarction, which is damage. So a myocardial infarction is an acute myocardial infarction is a sudden damage to the heart muscle. Now, this is an introduction only. It doesn't replace the information found within your book. When you come to class, you need to know every detail about the anatomy, the electrical patterns, perfusion, how to do a patient assessment, equipment that we use to monitor and identify issues, pharmacological agents that we use in chest pain, what is the definitive care that can help a patient, and we also need to review resuscitation, that's chapter 13, related to our CPR. Now, I do want to say that cardiology and resuscitation accounts for anywhere from 20 to 24% of your national registry questions. We will be talking about this in class. Are you going to be ready to talk about this? Are you going to be prepared? I really hope you will be. Thank you very much.